Good afternoon. My name is Martella Boris. I am the director for the each unit at Coast to Coast Legal Aid's Service of South Florida. We do public benefits work for the community. And today I have on our Friday with Friends two of my favorite people from 211, Dr. Mika Mears and Miss Billy Morgan. Can you both, Billy, I'll start with you. Tell me what you do and the organization.
Hi, good afternoon. It's great to be here. I'm Billy. I'm the Senior Director for Community Engagement and Impact, and my partner here, Dr. Mears. I'll let you introduce yourself.
All right. Hi, good afternoon, everyone. My name is Dr. Mika Mears. I'm the Director for Social Enterprise for 211 Broward as well.
Can you tell us a little about 211 and the service that you provide to the community?
We would love to. So let me go ahead and share my screen, and we'll hop into some visuals here. I'm a visual person. So 1 second, let's go from the beginning here. So we're going to talk about 211 Broward and what we do. Here is our mutual email. So if you want to reach out to us, it's c3@211-broward.org. It'll go to both of us. And we're going to talk about C3 and 211. Let's start with 211 Broward. I hope that everybody here knows and understands the magical 3-digit number that is 211. So I'll start off with talking about the many services that we do, and then I'll hand it over to Dr. Mears, who will be expanding more, and we're going to share more about C3 and this exciting new endeavor for our community. It's going to really transform the way we do care in our community. So what is 211? It's here. It's free, confidential. It's always available to you. It's 24 hours a day. We never close. There's a 10-digit number there. You can always dial 211 on your phone. And we're offering emotional support. We provide assessments. We provide information and referral. And you can see here on the right here, there's a visual here of the many things that we connect our community to through this service. We are a nonprofit. We are funded by United Way, Children's Services Council, and many other foundations and organizations keep our doors open. And here is just a visual of the many things, and some might pop out to you that might be important to you: healthcare, education, mental health, addiction, crisis, food. We all know somebody who needs help out there. And we're going to talk about how the work that we do at 211 really is going to transform through our C3 coordinations and how we deliver this service to our community. So I always like to do a big picture of 211. As you can see, food, healthcare, government services, anything our community needs, we're the number to call when you don't know the number to call, right? So everything in our community is here at your fingertips. And you also saw the website, so you can chat with us, you can text us, you can go to the website and look at the resources on your own. We just want to help our community, and we help thousands every day. So the 988 is a number that our 211 also answers in our community, and 211 is in 95% of the nation. So anywhere your individuals that you're working with or you yourself might go, dial 211 and you'll get the help that you need. 988 is for crisis, mental health, and if you don't know what to say or do, that's the number you can call. And our counselors are highly trained to be able to help you help that person or help you if you are in harm's way. And then we know 911. The whole point is whole person care. And you can see where it integrates as well. So just one last slide about 211, just to remind you, we're free, we're confidential, we're anonymous. The caveat to that is if you know somebody's going to harm themselves or somebody else, then we have to renegotiate what that anonymity might look like, but we are there for that. And we want to make sure our community stays safe. So call us if you don't know what to do, or if you need help, or if you know somebody who does, or if you want to give help somewhere, if you want to volunteer somewhere, donate. People think, oh, I never want to call 211. I'm not going to be in that situation. Well, you do want to give, you do want to care. So there are things that our community can do for you as well. So emotional support is a lot of what we do. We're highly trained, highly adept at supporting our community. And assessment is really important part of the work, information and referral. So we assess what the person needs. And oftentimes the person might call needing help with food. And then it turns out they also need help with their light bill, or they might be in an emotional state. And crisis intervention is the most important call we get. That follow-up and advocacy piece is so critical. So we advocate for our community, veterans, seniors, children with special needs that families don't know where to go to find help. We have specialized programs that can help that person, that family, that individual navigate and find the care that they need. And then the last is that care coordination piece. And we have peers as well that have lived experience to be able to connect. We have a first responder program. We have veterans that have served our country that answer the helpline. So we can go on a very deeper level to be able to help our community. We all know somebody who needs help out there. It could be basic needs like help with rent, light bill, and food, and you don't know where to go. We'll let you know what's out there. We'll advocate if we need to. We might be able to help you make a phone call to an organization if you need that extra support. We're here and we care, and we all work together to be able to create this whole realm of help for our community, from seniors to children and everybody in between. This is a great number for you to utilize. Save it on your laptop, save it on your phone. Share this resource with our community so that they know this is a place to go for help, and we're here to help. So that's my soapbox about 211, and we are walking into a whole new endeavor in our community. How are we able to help our community and elevate this 211 service? And we're driven to improving this quality of care in our community. And my co-facilitator here, Dr. Mears, is going to talk about C3. She's been here from the beginning with C3, and we really need to go deeper to understand social and economic determinants and what the root causes are.
Right.
So,
thank you so much for that, Billy. And thank you for your thorough explanation as to what 211 offers. Let me say, this is one of my favorite places that I've ever worked because of not only the environment or the organizational culture, but what we have to offer our community. And one of the greatest things that I have the honor of being a part of is Community Connections Council, which we like to refer to as C3. And, you know, to simplify Community Connections Council to you, the best way to simplify it is C3, what we're doing, we're transforming our community by pairing state-of-the-art technology with human expertise to expand access to care. And the way we do that is by bringing together healthcare and social service organizations to create a seamless, high-quality system of support. And through those collaborations and coordinated care, we ensure that our Broward County residents receive the right help at the right time. By uniting community partners, we're building a stronger, healthier, and more empowered community right here in Broward County. And all of this is necessary because Broward County has out of all of the residents that live in Broward County, 34% were born outside of the United States. Not only were 34% born outside of the United States, but we have 11 zip codes in Broward County with the most underserved individuals. And those are the people who usually lack access to care, lack access to resources, and Community Connections Council provide the opportunity and is the perfect medium between our community members and the care and the resources that they need. So Community Connections Council, as I said, it's comprised of our community organizations that collaborate to provide this high quality care to our community members. You can go on, Billy, thank you. And how do we do this? So as Billy mentioned, she mentioned 988 for the suicide hotline, crisis hotline. She mentioned 211 as your community resource line. And of course, we knew that 911 we know that 911 is the emergency number. But when you put all of that together, we're taking care of the whole person. And we do that from a closed loop, person-centered approach. So we are listening to what our community members are asking for. We're trying to meet their needs that they identify, not solely to take care of one aspect of their lives, but to take care of the whole person by meeting their needs efficiently. And it's also important to know that 211 is a subset of the Unite Florida Network, which is comprised of many different organizations that provide the same high quality care. And it's like an ecosystem of social service agencies and healthcare providers that's dedicated also to the whole person. And we're doing this across the state of Florida. And we're excited every time we have the opportunity to add organizations to the network, you know, whether it's through by solicitation or they come to us, because a lot of organizations want to be a part of Community Connections Council, because the bigger picture is to ensure that our Broward County residents have the ability to really live an optimal life. All right. And as I said, I spoke about the Unitas Network, and I spoke about the Unite Florida Network as far as Community Council, Community Connections Council. So I'm going to hand it over to Billy to just take it from here.
Okay, that was amazing. So, and really understanding what C3 is all about, we wanted to share and have an opportunity to share how the Unitas collaboration works. So let's see if I can actually get this video going. I've got my audio shared. Ooh, let's go.
And before Billy plays the video, let me say this. This video is going to demonstrate the process of how Unitas, which is the state-of-the-art technology that is utilized to efficiently provide service to our community members, how it's transacted, how it works, and how it can possibly work in your organization as well. Please understand there is no cost to nonprofit agencies to be a part or to become a part of C3. All you have to do is reach out to Billy or I, and we will be happy to help you from there. We'll be happy to walk you through whatever you need to know. And we want to most importantly listen to your needs and your organizational needs to best help you serve the clients within your respective organization. So right now, Billy's going to play the video to demonstrate to you how C3 can be instrumental to you as you serve our community members.
We all know how important it is to address people's health and social needs early to improve outcomes. However, today's fragmented landscape of care doesn't always make it easy for people to get help. What if everyone could get the care they need when they need it? And we had the ability to track it all to actually improve the way care is being delivered. No paper referrals, no pamphlets, no missed appointments. That's where Unitas comes in. At Unitas, we're transforming the system to ensure that health and social care providers can work together in one network. With our suite of solutions, we've been working hand in hand with local partners to build healthier communities across the country since 2013. How does it work? Anna's story is a great example. This morning, Anna arrived at her local food pantry. She told the staff there that she was struggling to pay her utility bill for that month. After capturing Anna's consent to have her information shared across the Unitas platform, they immediately referred her to an organization offering income support through Unitas, and Anna was able to get help that week. Since Anna had already been referred to the food pantry through Unitas, we located her record, and this referral popped up on her timeline for both organizations to see. Once Anna received money to cover her utilities for the month with the help of her financial assistance provider, the coordinator there securely sent a status update back to the food provider. By working together, they made sure she got the care she needed. Every community is different, which is why Unitas supports flexible network structures. Our system is always evolving. No matter where we start, our goal is to make sure everyone has access to the network. Unitas securely tracks every health and social care referral, interaction, and outcome across Anna's care journey, and not just whether a need was addressed or not, but what actually happened. This data allows us to assess what worked and how to improve the quality of care for Anna and people just like her. The impact of our technology depends on the people using it. That's why we have a community engagement team that's dedicated to growing and improving the network and its performance over time. With the data generated by our platform, we can identify what's happening and where there may be gaps in resources. By empowering our partners with these insights, we can better address people's needs and even predict who will need services, when, and where. In time, the community-based organizations can be paid the same way the healthcare system is for the work they do. Anna's story is one of many just like hers. Here at Unite Us, we envision a world of truly connected communities. Join us in getting there, one story at a time.
All right, thank you.
All right. So, I'll
Great,
just,
great presentation. Do you have a launch date for the C3 Unite Us?
And that's where we're going to next. Yes, as a matter of fact. Dr. Mears?
yes, actually, we do have a launch date that will be July 1st. And I'm glad that you asked that because right now we are in the process of facilitating our strategic partnership pilot, which is comprised of 211 Broward's top 10 agencies, community partner agencies. And the strategic partnership pilot provides an opportunity, as it just reflected in the video, for the administrators and those who really help or govern the platform to help the new oncomers to pretty much navigate their way through the system. So the strategic partnership pilot is going to provide a level of concierge-like hands-on mentoring and services for the users of the United platform, the Unite Us platform, which is, and they are all a part of the Community Connections Council. So this is really, really, really exciting for us. And it's also exciting to talk about the Medicaid redetermination project, which Billy will speak about momentarily. And she will tell us about all of our wonderful partners that we had, and you will get to know how great that opportunity was and how many community members we were able to really assist in that. So the C3, we're going places. We're really transforming the Broward County community. We have a launch date of July 1. That's what it is so far. And we're excited about our strategic partnership pilot, which is currently active, and we're in that process right now. And we have the amazing opportunity to work with the leaders of these organizations to really collaborate and strategically collaborate on ways of how to transform our community and to better serve our community members. So I'm going to turn it over to Billy to talk about some of our victories and some of our successes.
And we're so happy to have Coast to Coast Legal Aid as one of our pilot projects. And this is just some of the special projects that we've been able to embark on and have success. So we provide ongoing support with our community care plan program. And we just concluded our Medicaid redetermination project with amazing success. And we were able to help so many families in our community get connected to health insurance through our partnerships. And so we're really proud to have that jewel in the crown and working with Legal Aid to be able to have that success, and our other partners, Urban League as well. And seeing that 211 was that conduit to connect our community to where to go to help was really where that platform began. So with the few minutes that we have left, what's ahead? And we are providing mentorship and support to our current users on the C3 network. We're growing this partnership pilot project. We're so proud to have the partners that we have as we embark on this transformation in our community. We're acquiring knowledge on how to customize a platform and make it available for everybody, because we feel and know that this is the best opportunity for us to really improve the way that we do the work that we do and help our community in Broward County and beyond. So we're providing mentorships, we're discussing experiences. We have down here our facilitator and our meetings that we have monthly with our partners, and we continue to be able to grow this partnership, and really we're going to be expanding this beyond, and July is when it really launches. So it's just a beginning. So we're one community. We want to do this together. We want to make sure we're engaged and working together, and we're a powerful force, and you're a part of it. So we thank you.
Yes, thank you very much.
Thank you, ladies. I could feel your enthusiasm for the future of the Community Connection Council C3. And we're going places in Broward County. And with your help, we'll be able to provide, not just provide services to our clients, but to connect our clients to services throughout the whole community. Again, ladies, thank you for participating, and I will see you again soon.
Our
See you
pleasure.
soon. Thank you, everyone. Take care.